here to apply the trans-theoretical model. Pre-contemplation, the first stage of the trans-theoretical model, is not noticing that you have a problem or acknowledging it at all. So that would be like not taking your regular insulin, not eating right, as for example, drinking pop and donuts and cupcakes, totally disregarding that you have anything once you've been told that you have the disease. The next stage is contemplation. Is you realizing that there is a problem and you start thinking about change. You're not really doing anything about it yet, but you are thinking about it. Next stage we have preparation stage, setting realistic goals. For instance, getting your insulin prepared in the morning, your pills, your blood glucose meter, and anything else that you might need for the day. Next stage we have is the action stage, putting these goals to work and really following up on the word that you set for yourself. So, like for instance, when you go to take your pills, you actually take your pills. And when you go to get your insulin, you actually take your insulin. So all the goals that you set, you're just putting them actually to work. And then we have the maintenance stage, which you're just maintaining everything so that it just becomes a habit every day. Make sure you take your insulin on time. Can't stress that enough. Make sure you eat right. Can't stress that enough. Make sure you have your pills and your blood glucose checked every 4 hours. And then we have the termination stage, which is just the final stage of the trans-theoretical model. Basically, that's just saying that everything is now a habit and that you don't need anything else because you are already doing this in completion. Thank you.
Prevention of diabetes that is not hereditary is watching what you eat, exercising, remaining stress-free, and regular doctor's visits. Treatment for type 1 diabetes is insulin, exercise, and nutrition counseling. Treatment for type 2 diabetes is insulin, exercise, nutrition counseling, and pills. According to carediabetes.journals.org, current empirical evidence of this condition is regular consumption of sugar-sweetened beverages including soft drinks, fruit drinks, iced tea, energy drinks, and actually vitamin water. These could all develop type 2 diabetes.
Type 2 diabetes is on the rise. It's most prevalent in minority groups such as Native Americans, African Americans, Hispanics, and Asian Americans. Men are at a slightly higher risk of having diabetes than women. If you have both parents have diabetes, you have a 75% higher risk. If you have one parent, you have a 15% higher risk.
Frequent symptoms of diabetes are excessive thirst and appetite, increased urination, unusual weight loss or gain, fatigue, nausea, perhaps some vomiting, blurred vision. In women, frequent vaginal infections. In men and women, yeast infections, dry mouth, slow healing sores or cuts, itching skin, especially in the groin or vaginal area. You should call your doctor about diabetes if you feel nauseated, weak, and excessively thirsty, are urinating very frequently, have abdominal pain, or if you are breathing more deeply and rapidly than normal, perhaps with a sweet breath that smells like nail polish remover. You need immediate medical attention for ketoacidosis, a potentially deadly complication of type 1 diabetes.
Having a sedentary lifestyle, which involves exercising less than 3 times a week and also eating unhealthily, can also lead to type 2 diabetes. A very important risk factor for type 2 diabetes is impaired glucose tolerance. Another word for this is prediabetes. Some people believe that if diagnosed with prediabetes, that they're safe from diabetes, but this is definitely not the case. Insulin resistance is also an important risk factor for type 2 diabetes. This often starts with cells that are resistant to insulin, and with insulin resistance, the pancreas has to work overly hard to produce enough. This can also lead to type 2 diabetes. Polycystic ovary syndrome in women can lead to type 2 diabetes, as well as age. Doctors advise anyone over the age of 45 to be screened for diabetes.